Your clients come in, you've got to make sure that you're set up and prepared for treatment. So making sure that your bed is clean, and you need to make sure for anything needling then blood could come from and bodily fluids, you need to make sure that you've covered your bed with anything that is throwaway. So you can get plastic covers, but it must be thrown away, or disposable towels you can put over. But for when you're doing your assessment, you'll just need some couch roll on your bed. You'll also need to make sure with your setup that you've got everything on wipeable surfaces. Anything that can be used and thrown away, so your sponges will be your single use and you'll throw them away after you finish with your client. You've got all your products, and again these are all wipeable, and you've got everything you might need. Nothing is going to be reused on anybody else for our hygiene. So have your trolley ready, and when you do your assessment, once you've done your consultation with your client, you need to make sure that you're wearing all the correct PPE. You need to make sure for your assessment it is very obvious as well that when you are washing your hands, so you'll say to your client, if you can just get on the bed and I'm just going to go wash my hands. And you make sure you leave and go and wash your hands. Make sure your hands are nice and dry, because otherwise it's very hard to put your gloves on. And then when you are putting your PPE on, you also have to wear a headband, so you need to make sure that you open up and pop your headband on. Masks, even though they're not compulsory right now, they are still PPE. You will wear your gloves and you will wear an apron. Your clients also will put on a hairnet also. And so you need to make sure for your assessment, if any of that is missing, you will fail before you've even started. Okay, so just want to go through some of the appearance things that can affect your assessment decisions. Your hair needs to be up, not with little bits coming forward. You need to make sure when you're looking down that your hair is not falling down, as well as obviously wearing your hairnet when you're doing treatments. You need to make sure that you are wearing a suitable uniform, one that is clean and that you've got good body hygiene. Again, you've got to be clear of bracelets, long sleeves, watches, any of those which can actually sort of catch clients and be cross-infection. So we are following hygiene protocols that are followed in medical practices. Wedding bands you can keep on, and with regards to nails, you cannot have long nails because again they're a health and safety hazard. If you are wearing any nail polish, you need to make sure that it looks professional, so that you ideally want to have a nice simple colour, or again something that's not chipped or damaged, because it doesn't look professional. And then also you need to make sure that your earrings, you've not got long earrings in, so anything that can be dangling down in the area needs to come out. These are all things you will fail your assessment with before you've even started. On your feet, flip-flops are a no-no. You've got to make sure you've got closed-in shoes, that they are hygienic and clean and suitable to be worn in the salon. They need to be flat, no heels. And again, you need to make sure that when you're walking around that it's not making too much noise, especially if you're doing a relaxing treatment. So please remember these as part of your assessment process. You've got to look the part, you've got to sound the part, and you've got to make sure that you are doing everything as hygienically and safely as possible. Right. So for this client, we've selected Glow Peel and we're using Mix 1, which is the stronger one. So it means from our mixing ingredients, we're going to use 2 ml of the Glow Peel. You can use 4 pipettes, but I prefer to use syringe and go up to my 2 ml with an 18 gauge. So I've got my 2 ml in there. So we can put that. There we go. 2 ml. And then of my peel blender, I'm going to want 0.25 of peel blender. So I've got a 1 ml syringe and I'm going to go to that 0.25. So I've measured out now all my products that I need to be able to do the peel, but I'm not going to mix them until I need the peel. So hands washed, all PPE on. clothes from getting wet. I'm going to put a headband in. Put your head up for me. Perfect, and down. So technically with a chemical peel we're not going to have any blood drawn, but we're still following aesthetic practice of making sure that everything is disposable and throw away. And we will prepare our client for having the peel on their face and neck today. So I'm going to go in with my cleanser using one pump. I like to pop it on neat onto the skin. And then once you've got it on everywhere, make your fingers just a little bit damp, and then you can work with your cleansing circular motions. Making sure you're thorough with your cleanse, because anything left on the skin will act as a barrier to your client having an effective peel treatment. Always try and do your circles lifting up, ideally, because we don't want anything dragged down. We always want to lift tissues. Don't forget that top lip. And when you do the nose, do one side of the nose followed by the other side. If you do both at the same time, it was far hard for your clients to breathe. If you're going over with eye makeup remover, you would do this prior to this point, or some initial cleanses you can go over the eyes as well. But again, this client has chosen to prefer to leave her eye makeup on, hence why it is staying on for this treatment. Also, if your clients are wearing a lot of makeup when they come for the treatment, you may need to double cleanse, which is usually best practice, and doing 2 cleanses. Then with our warm water, we are going to now wash off that cleansing product. Making sure that everything is off, because anything is going to act as a barrier to making sure that the treatment is as effective as it can be. You can also blot the skin in preparation for the next product. This is also a good opportunity if your client has got a lot of makeup on for you to see the skin and any target areas that is of a concern. Make sure all rubbish goes straight into your bin. Then we're going to use the painless peel, which is a great starter for a peel treatment. One pump is all you need, and it's an enzyme exfoliator. Smooth this onto the face, and you want to leave this for about 30 seconds to a maximum of 2 minutes. So whilst this is on, I'm going to go get some clean water. So making sure your gloves are dry. Now you can do those circular movements over where that painless peel is, and it will start to sort of gather up underneath your fingers and take the dead skin with it also. So you can see these little particles start to form, and this is a good sign. This is a very mild peel at most. It is more of an enzyme exfoliator that's cleverly named, called a painless peel. And then any last little bits that are on the skin, you will use your sponges and clean water to remove. This is not a necessary step to a treatment, and if you aren't using the Clinicare products or have access to the painless peel. It's not compulsory, but I would recommend doing an exfoliation that is not a manual exfoliation. So one using a gritty product or a scratchy product would be an absolute no-no, because that would be too triggering and too scratchy for the skin. So you want to make sure that you are using an enzyme exfoliator if you are going to exfoliate. Any last little bits that are left, you can get them with your antiseptic, your Vitasept, and you can make sure that the skin is squeaky clean by using some Vitasept on some gauze, and then just working this over the skin. Warn the client that it will smell like a cleaner, which some clients actually like. Smells like alcohol. Yes. Just make sure that it's an antibacterial. Make sure that everything is off the skin, so nothing's lurking. So now we've prepped the skin and it's thoroughly cleansed and it's sanitized. So now we just need to do a couple of last prep things before we put the peel on. We need to make sure we put a protective barrier layer on more sensitive areas. So we pop some Vaseline on the back of our glove using a cotton bud. We need to make sure that we're putting a barrier at least on the oral commissure. Do you suffer from cold sores at all? No. If your client suffered from cold sores at all, you would put it all the way over as a protective barrier. You also need to make sure you're protecting the entrances and exits from the eye. So you literally pop a small amount just at the entrance and exit of the eye. And if your client has semi-permanent makeup on through their brows, you pop product through the brows also, because otherwise they could lose some of their pigment from their brows. If there was an open wound or something that you wanted to work around and didn't want any product to go in, you would also put a ring of barrier protection around it. And then the last bit is just protecting that entrance into the nose, that sensitive area where you can sometimes have a cold and it can get a little bit sore. But I always leave that to the end because no one wants a cotton bud that's been around their nose near their mouth, even if it's their own. So now I've prepped the product. Now it's important that you have a timer so that you can time it. So I always use my fob watch, because you shouldn't be touching phones to check times. So make sure that you have your timer available. And then we're going to go in with the peel. So I've got my peel solution and my peel blender, and I'm going to add these into my little Petri dish. And this is when the peel product will start to work. So to mix this, I will use a cotton bud, just to make sure that my solution is thoroughly mixed. But as soon as I start to mix it, my peel is going to start to work, so I don't want to spend too long going through that. We apply with gauze wrapped around our finger. We don't use brushes because the protocol that comes from Clinicare states to use gauze. You always follow your manufacturer's instructions. So I've got my gauze on my fingers. I now make sure that I have product on there. I look at my time and I know this is a maximum of 7 minutes. So I'm going to apply a thin layer with what's on my glove. Making sure that I don't overlap any areas. How does that feel? Okay. Yeah. So eventually it might start to tingle. Let me know if it tingles too much in any area. It kind of builds up and then goes down. With 10 being the most painful thing you've ever experienced, let me know if it gets to a 5. Okay. Things you're looking out for when a client is having a peel, you're looking to see how their skin reacts. So you might see erythema, that's normal, don't panic. One thing to watch out for is frosting. With some of the more aggressive peels, your frosting might form, which is like a white patch. If that happens, and depending on the peel protocol, if you see that frosting, you can neutralize that area, or you can choose to neutralize everything depending on the pain with the client. But I'm waiting 2 minutes and then I'm going to layer it up. Some peel ingredients will auto-neutralize, some will need to be neutralized. So you allow this to penetrate in, and then you will then put the second layer on after 2 minutes, and you'll keep layering up every 2 minutes until I've hit the maximum time of 7 minutes. So I'm going to pop some more product onto my gauze. Now this time, because I started on the neck and worked my way up, I'm going to actually work my way down this second time. So I'm now going to go across the forehead, I find if I always start at the same point, there's always a lot of product in one area and not enough in another. And then I will wait a further 2 minutes. So I can throw these away now. And then time to my 7 minutes. So I've got 2 minutes left. I'm just going to get some clean water. So you prepare the hands in a very similar way as you would do with the body. Cleanse over. You still leave it for 7 minutes. Approximately, yeah. Block dry. You can do your painless peel and that if you wish to on the hands. The main thing to be looking for as well is for like cuts that obviously if the peel was to get in there would be very stingy. So I'm going to make sure I cover anything that needs to be protected. Also dry cuticles as well, but I'm just going to pop a little bit over that cut there because I don't want it to sting. And a little bit there. If client had really dry skin as well, they may be contraindicated. And then we're going to apply our peel in exactly the same way as we have done previously. With our gauze. And layering our product. So, nice smooth strokes. No overlapping. And time your 7 minutes. How's that feeling? So reapply your peel every 2 minutes up to the maximum of 7 minutes on the hands. So to complete your procedure, once your client has left, you obviously need to tidy your treatment room. So we need to make sure that anything that needs to be washed up will go into your washing up. Your sponges will go into your waste bin. That has been collecting your waste. Your bowl will go into the washing up. Then you're going to wipe over your products to make sure that they are sanitized using your sanitizing spray. Making sure that you there's no cross infection. And then if you are putting your products away into a cupboard, that they obviously get popped into the cupboard straight away. Or if you're getting them prepared for another treatment, then you'll get them prepared in your treatment area for your next treatment. Even products that I haven't used, I will still wipe over, as it is good practice to making sure that everything has been cleaned. We know that there's no blood contamination because we're not breaking the skin with this treatment, but there's still risk of cross-contamination and good practice to making sure everything is cleaned. You need to also make sure that your bed is wiped down and left clean for whomever comes next. Our rubbish bin is going to go into our waste bin. Again, it doesn't need to go so much into the clinical waste bin because we're not breaking any skin. I've got that in there. And then spray down the bed to complete. Doing all of this with gloves on as well. And then you're all finished.